shocking 2/3 of people injecting in this country, in the UK, are actually not even medically qualified. Hi, I'm Dr. Sunny Dhesi and welcome to newsletter 3 from a very rainy London. I'm actually here to do work for a private medical company, and I'm going to introduce you to today's newsletter. I'm going to talk about some statistics from the industry. Shocking 2/3 of people injecting in this country, in the UK, are actually not even medically qualified. And we're also going to talk a bit more about stress management and the impact it has on your health, women's health specifically. So I'm going to get out of the rain and carry on in a second.
Now that I'm out of the rain, it's a lot more comfortable. So before we go on to the importance of stress in women's health and the impact it can have long term, I just want to talk to you a bit more about personalised health. So this is the very reason why I am here working for a private medical company, is to bring this level of care, this level of personalised care to Vysana, to clinic. Why is personalised care important? I mean, it all stems from, for example, aesthetics. No patient is exactly the same, although the techniques we use, for example, wrinkle smoothing injections or dermal fillers, the techniques that we use have a foundation that we apply to every one of you coming in. The difference is it's personalized care, and that's a natural evolution from delivering excellent aesthetic treatments, wrinkle smoothing injections, volume replacement, anti-aging solutions for how we look, to now applying it to what's going on inside. So in traditional medicine, we use a one-size-fits-all approach. You know, if you were to come and see me as a GP, we have a very limited time. It's more about problem solving. I have a pain, I have potentially an infection, I feel unwell. Very much one size fits all. You know, if it's an infection, it's antibiotics. If it's pain, it's pain relief, and then obviously going down the route of scans and imaging and so on. As a patient here at Vysana, you get to see me more often than you probably get to see your own GP. So that's why I want to evolve our approach into a more personalized medical care. So yes, brilliant. We definitely are still focused on doing aesthetic treatments, the anti-aging cosmetic skin treatments that make us feel and look good, bring back our youthful looks, but we also want to apply personalized care. For every one of you, it's different. Now, a good example is how often we talk about hormonal management. So again, a great news article, a great insight from Louise Newson, who owns the Newson Health Clinic, who is a menopause specialist. And the research that they did and they published at a general practice conference was that women often go to 10 appointments with their GP before they get to the outcome that is beneficial for them, personalized care. It takes 10 appointments. So one of the things that we offer at Vysana informally, when you do come in for aesthetic treatments, you're seeing me, you are going to get that informal lifestyle investigation, that lifestyle questions about your hormones, about your mental state, your gut health, your diet and your nutrition, and it all links back in to the treatment we're delivering. Again, whether it's injectable treatments, skin treatments, whatever it is, I'm going to link that back in. Now, on a bit of a lighter note, it was raining outside, as you saw in the video, but that still, again, doesn't mean, I don't know, I'm going to sound like a broken record here, but again, it still doesn't mean you neglect your skincare, especially SPF. So for example, today, what I did, I knew I was coming to London, so I used a cream-based cleanser from Illumier. I then used a serum from Meda for its anti-aging, so a lot of peptides and also ingredients in there that help with glycolation. So it helps to protect against the environment, and it also helps to reduce glucose or sugars binding in your skin. So a very interesting serum that I used. And obviously on top of that, I used actually a Teoxane SPF 30, slightly tinted, to help with a little bit of the dark circles under the eyes. It was an early start. But again, skincare is very important, and SPF is equally important. Even if it's cloudy, 80% of UV rays are still penetrating through the cloud, and they will reach your skin and they will impact. And again, because I'm traveling in London, I wanted to layer my skin care so that I was able to protect against the environment, especially traveling on the tube. Now, I did promise to talk about stress. So what is the impact on stress? Now, we see that impact on our skin. So when patients come into clinic, we see volume loss, we see breakouts, we see lines and wrinkles forming. So stress has a massive impact and that can have long-term effects on our cardiovascular health. And I want to talk a little bit more about, for example, blood pressure. Now, one of the things I always ask patients is, when was your blood pressure last checked, especially if you're in your 50s or 60s. And in many cases, patients will say, well, it was fine. Actually, my blood pressure always runs low. And when we do sometimes do an impromptu blood pressure check, it's actually can sometimes be high. Now, yes, it could be white coat syndrome, the anxiety. But then again, let's think about that. The anxiety and the stress of having your blood pressure taken is enough to give you a rise in blood pressure temporarily. So what else is giving you that rise as well? What other impacts is that having? Now, that can have a big impact on your heart health, your cortisol levels, your brain function. And these are things that we want to prevent later on in life. We want to prevent cardiovascular disease, so high blood pressure, stroke, dementia, vascular dementia. These are all things that we talk about in clinic, and we can go into more detail as well. So stress is really important. Now, what can you do about stress? So one of the things that I did this morning was that I listened to positive affirmations. There's a great YouTube site from Bob Baker. Definitely check it out. If you want more details, then drop us an email. I can share the link. Headspace is a great app as well that I sometimes use. Mindfulness and breathing. Now, it's a bit controversial. Studies are coming out saying that mindfulness doesn't help, but I think it does. It sets the intention for the day. And lastly, I'm going to end on, again, research in the industry. If you are choosing a practitioner, obviously we love that you continue to come back to us in Vysana. We are all medically qualified. I'm medically qualified. Charlotte, our nurse, is also an advanced nurse practitioner. So any treatments that we offer are done by medically qualified professionals, but that's not the case for the rest of the industry. So if you've enjoyed this newsletter, please do share it. Please send us an email. If there's any more details that you'd like about what I've discussed, then please email us or book into clinic for a consultation. And again, share this with your friends, with your family, and to spread the empowerment that knowledge brings. Thanks for watching.